Hello, welcome to another OET writing lesson with Bose Learning. In this video, it's going to be one of those Your Questions Answered videos. That's where you ask me a question and I try and answer it. And this is from one of you guys, one of my YouTube students who asked me this great question. And they said, thanks for your informative presentation. Thank you for watching. And they just wanted to know whether they are allowed to use the word patient in OET. So I think that's a really great question. And if you have questions like this, then the best thing to do is to ask a teacher like me. For those of you who don't know me, my name's Sona. I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider. So you know that the kinds of questions you ask and the kinds of answers I give you are quite good because I'm a premium preparation provider. And if you can't ask someone like me, please do ask me because I'm happy to answer them if I can. But, maybe you can't ask for whatever reason, then the next best thing is to check and not just worry about what to do, but check the OET website itself, because that's where you're going to get your answers. That's where you're going to find the answer to your question. So always look at the OET samples, because that's going to be the source of really good information for you if you can't ask a teacher. But of course, this lovely YouTube student has asked me, and I'm very happy to answer this question for you today. So, should you use the word patient in your OET letter? Obviously, in the role play, it's not really needed because you're going to be addressing the patient by their name, and you can find out their name by asking them, or asking the interlocutor in the 3 minutes preparation, or asking them in the role play itself. I've done a video on how you address the patient in your role plays, so do check that out. But in terms of letter writing, what do you think? Do you think you should use the word patient when writing your letter? What does your gut instinct tell you in this case? And the thing to remember for all letters, referrals, transfers, discharge letters, is that the patient always gets a copy in real life. So, in real life, if the patient was you, would you like to be referred to as the patient came to see me, the patient said this, the patient reported that? It feels a little bit distant, doesn't it? It feels not so friendly, not so understanding. And my gut instinct is to say, no, we don't use the word patient in your letter very much, if at all. And let's just check this gut instinct of ours then. Let's see by referring to OET samples, and to see that, just see how the professional courtesy is extended to the patient as well as the reader of the letter. So we're going to check out some OET samples to see what they have used. And what I've done is I've just picked sample number 3 across 3 professions. So we're going to look at nursing, medicine and pharmacy today, and we'll look at how these have been used. So just to remind you about nursing sample 3, if you haven't seen it on the OET website, in this situation, you're a nurse at a boarding school, and Jake Patterson is a male student at your school and has come to see you complaining of hair loss and associated depression. Okay, that's the background. Your task is to use the information given in the case notes and to write a letter to Mrs. Cullen, a university practice nurse. And you're going to outline his history and your concerns, and they tell you who to address this to. So, what we're going to do is not look at the case notes because we're just interested in the sample letter in this case to look at whether they have used patient. And what you can see is at the beginning, they say, I am writing to introduce Mr. Jake Peterson. Okay. Jake presents with hair loss. Jake first presented. Jake's weight was reduced, or has reduced rather. Jake suffered extreme anxiety. and Jake is anxious about his transition to university. So we have his name being used a lot. We have his full name, including title at the beginning. And then we have Jake, 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 Jake. We don't have the word patient. What we do have, of course, are lots of pronouns. He was referred, he was prescribed, his condition, etc., etc. So we have his full name, just his first name, and then appropriate pronouns. There is no use of the word patient at all in sample 3. Okay, so that's sample 3 for nursing. Let's take a look at another example. This is medicine sample 3. And in this case, you're a doctor at Newtown Medical Clinic, and Mr. Barry Jones is a regular patient of yours. Using the information, write a letter to Miss Graham, an occupational therapist, detailing Mr. Jones's situation and requesting an assessment of his workplace, and they give you Miss Jane Graham's details here. So you're writing to an OT about his situation and requesting an assessment. Again, we're not going to look at the case notes, have a look at those yourself, but let's take a look at how he has been referred to. So of course, in the reline even, you put his full name and title. Aha, we have the word patient here. I'm writing to request a workplace assessment for the above patient. But again, I have the expression Mr. Jones. The written out Mr. Jones here. What else? Mr. Jones has been seeing a physiotherapist. Mr. Jones has been compliant. Mr. Jones's employer is supportive. And again, Mr. Jones's workplace. So we do have the expression patient, but after that, he's always Mr. Jones, or of course, the appropriate pronouns. He injured his back at work. He currently walks. He reports, etc. So in this letter, the word patient is used, but only as an introduction and only in referral to the reline. Okay, so that's medicine. So we've looked at 2, and there's only one use of patient so far. Let's take a look at a pharmacy sample. This time you've got a diabetic client, Mr. James Davidson, who's planning to travel abroad, blah, blah, blah. Using the information given above, write a letter to Mr. Davidson himself. So write a letter to him addressing his specific concerns. So you're writing a letter based on the consultation at the pharmacy and your advice. So I think it's fairly clear, because you're writing to the patient themselves, we wouldn't use client at all or patient. Thank you for your query. I can assure you, if you prefer, you are not required. So when you're writing directly to the patient, if you have to do that, then you just refer to them as you, not as the patient or the client. So although the term client is used in the instructions, it's not actually in the letter itself. And of course, patient is not used. So what can we conclude from this? Should you use the word patient in your letter? Well, I think our gut instinct was correct. No, not really, because it does sound very distant. The only time you can use it is in perhaps the introduction when you're referring to the reline. So I'm writing to refer this patient to you, and always give their full name. So what do we use instead? Normally we use their title and their surname, bearing in mind if it's an adult. We can use just their first name, but this is when it's a younger person, a child or a teenager. You can use it for a patient as well who's a bit older, perhaps if you know them very well and you are their family doctor or family nurse, for example. And of course, use pronouns as appropriate. So, I hope this answers your question about whether you can use the word patient or not in your letter. Thanks again for your question. As I say, if you have more questions, do ask me. I'm really happy to answer them for you if I can. If you like this video, it'd be so lovely if you could help me grow this channel by subscribing to me or sharing this with friends or colleagues. I've got over 250 videos for you, so please do check them out, because I'm sure you'll find something that you like and that you find useful. I've also got some on-demand courses which are available on Udemy, and I'll put in some discount codes for you below so you can check those out as well. And thank you very much for watching. Hopefully see you again really soon, and I hope to hear some more of your questions as well. All right then, take care, lovely to see you, bye.